Namaste, good evening. This is Dr. Aparna. I am an Ayurvedic psychotherapist. I act as a catalyst and support your emotional healing journey. So, I am an emotional healing synergist. I am a medical writer as well as an infopreneur. In my pursuit to address, promote, and propagate Ayurveda and psychotherapy globally, I speak on different topics of Ayurveda, mental health, psychotherapy, and related aspects. I also do book reviews in this genre. So, today's topic of discussion is what are personality disorders? So, when I say personality disorders, the first thing that comes to mind is what is actually the personality. See, what personality, that means your personality is your own way of thinking, feeling, behaving, and relating to others. So once you become an adult, your personality usually doesn't change much. That means personality is a person's unique patterns of thoughts, emotions, behavior, and it is at the core of what makes who we are. So my unique patterns of thought, emotions, and behavior, that makes me as a person who I am. So ideologically, the view of personality sees each person as unique. Each person has unique set of traits. So and then and each person has enduring characteristics and behaviors, so that compromise comprises a person's unique adjustment to life. And what are the major traits of the person, major interests of the person, major drives of the person, what are the values of that person, self concept, abilities, and emotional patterns. So all these comprises of personality. So what are personality disorders then? So personality disorders are a group of mental disorders. That means they involve long term patterns of thoughts and behaviors. So that are different from what is considered normal in our culture. So personality disorders, they involve long term patterns of thoughts and behaviors that are different from what is considered normal. So the thoughts and behaviors are unhealthy and inflexible. That's why it is called personality disorder. So what happens is, these they cause serious problems with relationships, with work, and social activities. So this can make it hard to deal with everyday stresses and problems. So, a personality disorder is a deeply ingrained, enduring pattern of thoughts, feelings, and behaviors that significantly deviate from cultural expectations. So, these patterns cause serious distress and impairment in a person's relationships, in professional life, and as well as in the social life. So, personality disorders usually begin in early adulthood, adolescence, and remain consistent throughout a person's life. So, if I have to simplify it, a person with a personality disorder experiences the world differently from most others. So they experience the world differently from most of us. So what happens is, how they think about themselves. So, people with personality disorders may have a distorted self image. That means seeing themselves as fundamentally flawed or having extreme fluctuations in the self esteem. Once they will think that they are great, and other times, most of the times they think, either they think them as superior, either they think them as inferior. So, and how they relate to others. So people with personality disorders may struggle to form healthy relationships, as I said, due to difficulties with trust, boundaries, or understanding social cues. So then there is problem with how they manage their emotions. So emotional responses may be very intense, they are unpredictable and poorly regulated, so leading to impulsive behaviors or emotional outbursts. So often their behaviors are impulsive, or there are often emotional outbursts. So this is personality disorder. So there are about 10 personality disorder according to DSM-5. So today we are going to discuss NPD, that is Narcissistic Personality Disorder or Narcissism. So many people have requested me, asked me to speak about Narcissistic Personality Disorder. So what happens here is they have a grandiose, self importance. That means you can say they have superiority complex. That means individuals with NPD have inflated view of their abilities and talents. They think that they are superior to others. Then deep need for excessive admiration. People with narcissistic personality disorder crave for constant attention, validation, and praise. So they do not have empathy. They have lack of empathy. That means they struggle to understand or relate to the feelings of others. So the next thing is the cause. When we come to the causes of narcissistic personality disorder, actually, the exact cause of narcissistic personality disorder is unknown. But few of the causes, like there could be some, a genetic predisposition. It could be due to genetics, but it is not, exactly known. It could be due to early childhood experiences. That means a history of childhood neglect, excessive criticism, or overindulgence. All these can contribute in developing NPD. So sometimes neurobiology also plays a role. According to some experts, they suggest that the brain structure and function might play a role in NPD, that is narcissistic personality disorder. When we come to the signs and symptoms, so what happens there? So as I said, DSM-5, that means Diagnostic and Statistical Manual of Mental Disorders, it says that a person with NPD has an inflated sense of self-worth and entitlement. So they have a preoccupation with fantasies of success, brilliance, power, or ideal love. They have preoccupied, fantasies of success, of their brilliance, of their power, or of their ideal love. So they believe in being special and associating primarily with individuals of high status. So as I said, they need, excessive admiration. So they constantly exploit others for personal gain, and they do not have empathy. There is lack of empathy. there is lack of relatability. So frequent envying, or the belief that others are envious of them, they always feel that people are jealous of them. And they also always have arrogant behaviors. They are jealous and they do have arrogant behavior. Most of the times their behavior is arrogant. So some behaviors are, as I said, exploiting others. What they do is they manipulate people to achieve their goals without remorse. They have hypersensitivity to criticism. That means they may react with rage, shame, or humiliation to even slight criticism. So they face difficulty with relationships. So their need for control, they always want to control their partners. So, and the lack of empathy. So both these, hinder healthy relationships. And underlying insecurity. So despite their, outward arrogance, people with NPD often have fragile self-esteem and are always also vulnerable to feeling worthlessness. Sometimes they sometimes from inside feel they are worthless, even though their outward expression is always arrogance, and they always see that they are superior, make sure that they portray themselves as superior, but still they are sometimes vulnerable to a feeling of worthlessness. So if I have to tell you some examples of, narcissistic people or narcissistic behaviors. So a person named ABC. So ABC is a successful CEO for his brilliant, business strategies. However, his employees find him insufferable. So due to his constant need for praise, and he always, his tendency is to belittle others, and he also takes credit for others work, and he also reacts arrogantly or angrily if anyone challenges his decisions. This is the first example. If I have to give another example, see, XYZ. So XYZ is an Instagram influencer, suppose, and she is obsessed with her image and follower count. So what she does is she spends hours curating her the perfect photos and captions to portray a life of glamour and success. This could be illusionary as well. you know she can't handle negative comments. She is very sensitive to criticism and is very quick to block or lash out at critics. So this could be a sign of narcissism. Then the next example is the entitled partner. So these cases come to us frequently. That means if we see that, if we take a partner, T. So T believes that he deserves the best of everything. So, in his relationship with his partner, he expects her to cater to his every whim, while offering little emotional support or no emotional support in return. He wants her to do as, act as per his whims and fancies. So he gets upset if she does not constantly reassure him of his superiority, and becomes jealous if she spends time with friends instead of him. So these are, there are many extreme cases as well. So these are some, some of the examples of narcissistic people. So in the next session we'll see what is the therapy that is, advisable for NPD. So here one more point is NPD exists on a spectrum. So, not all individuals with narcissistic traits have full blown, narcissistic personality disorder. So, not narcissistic traits are different, and narcissistic personality disorder is different. So, a thorough diagnosis is important, and then treatment offer is psychotherapy. You know, to what it does is to help individuals develop healthier coping mechanisms, understand the impact of their behavior on others, and cultivating empathy. So in the next session we are we'll discuss about how psychotherapy can help in narcissism, and what are the types of psychotherapy, and more about narcissistic personality disorder. So stay tuned. That's it for today. Thank you and namaste.